my name is Alyssa. I'm a PA student. I'm going to be doing your chest and cardiovascular exam today. I'm going to have you take off your shirt, shoes, and socks while I wash my hands. Okay, so I am examining the rate, rhythm, and effort of respirations, any respiratory distress, and accessory muscle use. I am assessing the chest configuration and comparing the antero-posterior ratio, which should be about 1 to 2. And then I am going to palpate. I'm going to have you cross your arms in front of you, and I'm just palpating the posterior and lateral chest wall for for tenderness and deformities. And then I'm going to check thoracic expansion, checking for symmetrical respiratory effort. So take a deep breath in and out.
This is your right side.
Good. And then every time you feel my hands on your back, I want you to say 99 slowly, and I'm just checking tactile firmness.
99.
And comparing vibrations bilaterally.
99.
Okay, and then I'm going to percuss the posterior and lateral chest wall, listening for resonance and dullness.
Like a rough gun.
So I'm just going to adjust your raw. Okay, and then I'm going to auscultate those same areas. I'm going to listen to one full cycle of inhalation and exhalation, and listening for any wheezes, rales, or bronchi. And then I should be hearing vesicular sounds over most of the lung, except for the main stem of the bronchi, where I will hear broncho-vesicular sounds. Okay, I'm going to have you take a deep breath in and out through your mouth every time you feel my stethoscope.
I don't know, just tell me which side you're on. So I'm going to do that, right? And then I'm going to move to the side of the bed?
Yes.
This is what aortic?
Yeah.
Okay. Hi, my name is Alexis. I'm the PA student. Today I'm going to be performing a cardiovascular and chest exam. I'm going to begin by washing my hands, and while I do, I'm going to have you take off your shirt, shoes, and socks, okay? I'll be right back. Okay, so I'm going to begin by inspecting your rate, rhythm, and depth of respiration.
All right, I'm going to have you go ahead and lay down now.
As well as use of accessories.
And then I'm going to be, again, palpating the anterior and lateral chest wall for any tenderness and deformities. I'm going to check thoracic expansion. So I'm going to have you take a deep breath in and out. And just noting or examining for symmetrical respiratory effort. Every time you feel my hands on your chest, I'm going to have you say 99 slowly.
99, 99, 99, 99.
Okay, and I was just checking tactile firmness and comparing vibrations bilaterally. And then I'm going to percuss, listening for resonance and dullness. And can you pull your bra down? Okay, I'm gonna have you pull your bra up. and then I'm going to auscultate the anterior and lateral chest wall. Again, listening to each point for one full cycle of inhalation and exhalation, listening for rails, rhonchi, and wheezes. And I'm going to have you take a deep breath in and out through your mouth every time you feel my stethoscope, and can you look that way? Can you lift your bra up? Okay. I'm going to move on to your cardiovascular exam. I'm going to have you sit up for a second so I can adjust the head of the bed to 30 degrees. Okay, we can lay back down. So I am just examining the jugular veins for any distension or pulsations. And then I'm going to have you look away from me, and then I'm going to auscultate the carotid arteries for bruits. I'm going to have you take a breath in and hold it. Okay, you let it out and look towards me. And then take a breath in and hold it. Okay, and let it out. And then I'm going to palpate the carotid arteries for rate, rhythm, and amplitude. Okay, and then I'm going to examine the precordium for any abnormal wall motions and the apical impulse. And then I'm going to palpate the precordium for any lifts, heaves, or thrills. So this is aortic, pulmonic, Erb's point, tricuspid, and then mitral. And then I'm going to find the point of maximal apical impulse.
So now I'm going to auscultate ventilation, exhalation,
And then isolate that to 2 fingers, noting the location, size, and intensity. And then I'm going to auscultate those areas. I'm listening for the intensity of S1 and S2 sounds, and then listening for S3, S4, rubs, gallops, and murmurs. So aortic, pulmonic, Erb's point. Can you pull your bra down? Tricuspid. Can you pull your bra up? Mitral. And then I'm going to listen again with the bowel side. Aortic, pulmonic, Erb's point, tricuspid, and then mitral. Okay, and then now I'm going to examine the upper and lower extremities for cyanosis, symmetry, edema, pallor. I'm going to look at your nails, and then ask them to take the nail polish off. And I'm going to check capillary refill, which should be less than 2 seconds. And then same thing for the toes. And then I'd wash my hands. And then I'm going to palpate the epitrochlear node for enlargement and tenderness. And then the inguinal lymph node for the same thing. Okay, and then I am going to, oh, did I stop recording? And then I am going to palpate the arteries, so for rate, symmetry, and rhythm and amplitude. So first is brachial. Okay, and then radial. Femoral. And then, oopsies. I'm going to bend your knee a little bit. So then popliteal. Okay. Okay. And then posterior tibialis. And then I'm going to dorsiflex your foot for you, and then dorsalis pedis. Okay, I'm going to wash my hands again. Okay, and then now I'm going to listen for bruits. So the first location is, I'm going to pull your shorts down just a little bit. So abdominal, renal, iliac, femoral, which I would do under clothing. And then I'm going to have you sit up, and I'm going to put the bed all the way down, and you can lay down. And then I'm going to measure the diameter of the aorta, which should be less than 3 centimeters.